Thanks so much for everyone being here, and thanks for this great group of people working on this issue. I know we've been working on the cost of health insurance for a long time. I was on the Insurance and Real Estate Committee, and we were always working on the cost of health insurance. So we have done a number of studies. And of course, this is something that we really need to take a look at. And there is an article put together by Senator Looney and Senator Cabrera, and that is in the Connecticut Post. It's October 19th, and it sets forth a number of practical ways for us to address some of the costs. You always hear from the insurance industry, it's about the providers and how much they charge. And then you hear from the people with insurance that there's this type of insurance for the ACA, or there's the ERISA type plans that are not regulated in Connecticut but by the federal government, and then there's the Connecticut plans. So there are all different types of plans, and we have to look at them all and see what we can do to address some of these issues. And so one of the things, there are three things that I'll mention, but if you go to the article, to the Connecticut Post on October 19th, you'll see all the issues that were raised by Senators Marty, Looney, and Cabrera. The first one is they said, why don't we create a Connecticut Administrative Procedures Act? If we had a Connecticut Administrative Procedures Act, what we'd be able to do is create a process where they would have to present all the reasons for the financial increase, take a look at what the medical loss ratio is for that type of insurance policy, and take a look at all the things, all the factors. Right now we don't have, the Commissioner of Insurance doesn't have that capacity to analyze all the totality of the requests for the increase in the insurance policies. The other thing would be to, once we have that in place, the next thing would be to create something that would analyze our pharmacy benefit managers. Now, this is something we've also looked at a lot in insurance and real estate. We've really worked hard to try and figure out a way that they would have to be able to tell us exactly what it is that they're doing with the insurance industry. Now, mind you, three of the largest insurance companies own 80% of the pharmacy benefit manager work. So what's going on is there are deals that are made with the pharmacy industry and the insurance industry that never get trickled back down to the beneficiary, so that they get the cost of the so-called kickbacks. And then there's also another thing that we could do, and that is take a look at the providers that are purchased by private businesses, or even the doctors that are purchased and put into partnership with our hospitals. They actually help set the price, and they decrease the competition in the medical providers market. Once the competition is decreased, people have fewer options to get to the provider, and the price continues to go up. And so if we included this kind of work with our Certificate of Need process, which is now governed by the Office of Healthcare Strategy, that would be another way for us to take a look at making sure we have more control over what goes on with our insurance costs and our provider costs. So I thank you so much for being here, and I continue to look forward to working with everybody on these issues.